Welcome back to the Band-Aid Man OC, your source for all things EMT, and that's it. Actually, you guys know that I do a lot more than that, but we're going to be focusing on EMT skills today. And specifically, we're going to be focusing on the National Registry skill sheet for BVM ventilation of an apneic adult patient. So this is going to be your bag valve mask and a couple of other pieces of equipment. So we've got a lot laid out here. I've got my awesome former students, Sean and Sarah. So we've got an additional EMT to help out today. We're going to be going through the process of bagging the apneic patient. And we're actually going to start exactly where we left off on our last video. So with our patient with a non-rebreather applied with oxygen being supplied at 10 to 15 liters per minute. So before we start any skill station, or really at the beginning of any skill station, we need to state that we have our scene safety all taken care of, and we've taken the appropriate BSI precautions. So we're taking all of our body substance isolation precautions. On this patient, I'll have Sean go ahead and start by checking for responsiveness. So to check for responsiveness, we can tap on the patient, we can say their name, or we can say, hey, can you hear me? But if they don't respond to that, we may need to use some type of painful stimuli, like a trap pinch or a sternal rub like Sean just did. Once he's identified that the patient is unresponsive, he's going to want to ask for additional assistance. So we need to get ALS, we need to get another unit on scene because this patient is going to be fairly busy. We're going to be all hands on deck. Once we've done that, Sean's also going to be checking for breathing and pulse simultaneously. So he'll be looking for signs of breathing while assessing for a pulse. That would be chest rise and fall, nasal flaring, anything that would tell us that he's breathing. Again, we're going off a skill sheet, so we're going to say it directly off of what they have. The patient is unresponsive, apneic, and has a weak pulse of 60. So the next thing that Sean would do is check the airway and make sure that it's open properly. But since he has a partner, Sarah's going to jump in and she's going to open the airway with a head tilt, chin lift. Because this patient's going to be medical, not trauma. As you are going through this skill, you'll be informed the mouth is full of secretions and vomitus. So Sean's going to turn around, start grabbing his suction equipment. And while he does that, Sarah's going to go ahead and remove the non-rebreather mask. She'll take the mask off and she'll continue to hold the head at a head tilt chin lift position so that we've got everything open. Now that Sean has his equipment and he's got everything ready, he'll turn on his suction device. Once he turns that on, he confirms that it's running. And we're making sure that the hose isn't underneath the suction device. We'll go ahead and we'll apply suction. We want to make sure that when we put the rigid suction device in, we're not going in further than we can see. We're only applying suction for 10 seconds and only on the way out. Now that he's suctioned the mouth and the oral pharynx, the tester would say the mouth and oral pharynx are clear, so Sean would turn off the suction canister, move that back out of the way, and Sarah's going to continue opening the airway manually while we prepare to put in an OPA. Now we've already figured out which OPA fits best. The yellow fits the best, but the red is going to be the one that we utilize because it will seat itself more properly on our mannequin. To effectively size an OPA, we're going to check to make sure that the OPA is the length of the corner of the mouth to the corner of the jaw. As you can see here, this one's a little bit longer, but it does seat better. Once we've done that, we'll go ahead and we'll put the OPA in, starting at an upside down or 180 degrees opposite, push the tongue down, and then when we're about halfway in, we'll rotate so that it's seated properly. And then we'll go ahead and make sure that it's resting right on the lips, just like Sarah's done. So it should be resting on the lips. We also want to make sure that the patient does not have any kind of gag reflex. And if we're applying an OPA, when we start to put that device in, if the patient begins to gag or they sound like they're about to throw up, the gag reflex is present, that OPA isn't going to fly. For patients that are unresponsive, will likely not have a gag reflex. So we do want to be aware of that, but be ready to go ahead and take the next step if that gag reflex is gone. So at this point, the examiner would say, no gag reflex is present, and the patient accepts the airway adjunct. Now that we've done that, and because we have two providers, Sean can take this time to disconnect his non-rebreather mask and attach his bag valve mask so that he's got oxygen flowing into the mask itself and into the reservoir bag. Since we don't have oxygen on this device, we're just going to act as if we've done all the regular processes. And again, we're utilizing 2 providers instead of 1. So now that Sean has all of that applied, and we have Sarah, who's holding the head in a head tilt chin lift position, we'll go ahead and apply the mask and have Sarah hold onto the mask using the CE grip on both sides while still maintaining that head tilt chin lift. And now Sean will bag so that we can start ventilating the patient. Now, at this point, the examiner would inform the candidate that ventilation is being performed properly without difficulty, and we should be looking for the normal signs that we would look for in any patient to make sure that they're being ventilated, which would be equal or bilateral chest rise and fall. This mannequin is actually set up more for an advanced airway, so if it's difficult for you to see that the chest is rising and falling, it's probably as a result of us using a basic airway adjunct and a BVM. Also, we're not going to see a whole lot of chest rise and fall because we took his whole chest off so that you can see the lung fields. Now that we're doing our ventilatory support, we're going to check a pulse for no more than 10 seconds. We'll do a second pulse check. And again, when we're checking for a pulse, we want to check on the side closest to us so that we don't wrap our hands around their trachea. Makes it kind of look like we're choking them. Once we've done that, we'll continue ventilating at a rate of 10 to 12 per minute, which is every 5 to 6 seconds. And Sean already knows how to do that. And you can see that Sean's still assessing for a pulse, even though he doesn't have to right now because he's got somebody else, his partner, holding the mask in place. So he actually has a free hand. But we really want to use both of those hands on the mask. And if we've got another person holding the mask in place, both of the hands on the bag so that we can control it. There's nothing worse than losing your bag in the middle of a resuscitation attempt because it wasn't properly secured in your hand. And believe me, it does happen. After this, the examiner would ask the candidate, how would you know if you are delivering appropriate volumes with each ventilation? At which point, Sean would answer, I know that I'm applying appropriate volumes with each ventilation by assessing for chest rise and fall. I'm also assessing how difficult or how easy it is to get air in. And I would also ensure that my oxygen tank is effectively delivering enough oxygen into the reservoir bag to effectively fill it between each breath. At this point, we would start looking at our totals, make sure that Sean passed and Sarah would not be doing the test at this point because she was assisting. So we would be looking at Sean's performance and grading him based off of that. And then, of course, looking for any kind of critical fail criteria, such as, again, failure to take or verbalize your PPE precautions, failure to suction before ventilating the patient, failure to ventilate the patient effectively or appropriately, not managing the patient as a competent EMT, the list goes on and on. But as long as we follow all of these steps and we go in the order that they are directed, we will absolutely pass every single time. If you're one of my students, you already know that your National Registry skill sheets are available in my virtual classroom on Canvas. And if you're not one of my students, I'm going to direct you over to the National Registry website where you can download all of your skill sheets as a PDF so that you can study before your test date. Again, it's always important for you to remember that your local policies and protocols are going to be what takes precedence when you go out into the field. So these videos are just so that you can get through your EMT program and be successful once you get into the psychomotor skills testing section. As always, I appreciate your time. Keep up the good work out there. I'm Eric Johnson, AKA the Band-Aid Man. It's been great. Be safe out there. Goodbye.